Hi, I'm Dr. David Dow, and we're here in our chiropractic room today. And one of the questions I get from people is, how can chiropractic help correct my heartburn? Now, this is to me, I like to use this as an example for a lot of people of how important it is to make sure your nerves in your body are working correctly. So what I mean by that is when the nerves in your esophagus, which relates to heartburn, are working correctly, your body is going to be able to sense the food coming down, and then it's going to tell your body to relax the muscles to allow the food to come down into your stomach. So those nerves are doing that. Those nerves are sensing the food and relaxing the muscles to let the food come into the stomach. Now, at the same time, those same nerves will sense the acid coming up from the stomach and make those muscles contract to keep the acid down in the stomach so it doesn't come up into the esophagus and cause the heartburn. Now, only the nerves can do that. And what I see so often is people are taking digestive aids to reduce the acid in the stomach. What I want you to understand is when you reduce the acid in the stomach, you're actually not making the body sense the food coming down or the acid coming up or make those muscles constrict or relax any better. The only thing that can do that is the nerves. So we want to make sure that the nerves are working properly in the body. And the areas that are going to relate to that are going to be mostly in the lower neck and in the upper back. And so it can be a stress response. So for example, if you're under a lot of stress for a long period of time, a lot of things are going on, you can start to go into a sympathetic state, a fight or flight state. And when you're in that fight or flight state, your body is going to turn off your digestion. And when you turn off the digestion, all those functions are not going to work, and it might not close tight enough that acid can start coming up. Or you could damage the parasympathetic, which are the calming nerves, which make the digestion work better, by getting a head injury or a low back injury. Those are the two places that have the strongest parasympathetic nerves in the body. And if those calming nerves get damaged, then your body shifts and starts using more of the adrenaline and fight or flight system. And that's going to be stressed kind of all the time rather than just in short bursts. That could be part of the problem. There could be a nerve problem where you got an injury to your neck, maybe a whiplash or a fall or a sports injury, or to the upper back, some type of an injury where that bone shifted out of place, the bone starts to hit against the nerve, and that pressure is on the nerve, and that's causing the esophagus to not function correctly. So while that pressure is on the nerve, what so many people will do is they'll take those medications to reduce the acid in the stomach that sometimes work so well that they never address the cause of the problem. They never get the bone off the nerve so that the body can start healing properly. And the other thing that can really do that is going to be that forward head posture, which I see so often when people are on their phones or they're on their computers. And when your head is forward like that, the bones in your upper back start to shift backward. And over time, you start to get a hump on your upper back. I always like to make sure my patients are looking good in their glory years so that they don't have to worry about that hump there. But at the same time, those nerves go to the esophagus, but they also go to the heart, lungs, chest, they go to the arms. So there's other things that we may notice that also tell us that there's pressure on those nerves. And if you feel on there and it's sort of the touch, that's a dead giveaway that there's what we call a subluxation. There's a bone out of place pushing on the nerve, and that's what's causing the heartburn problem. And you can take those antacids and those other medications for your entire life and never actually fix the cause of the problem. And those same nerves could be damaging your lungs or your heart. And you go through your life without even being aware of the problem. So one of the best ways we do to check for that is a good thorough history. We take x-rays. We like to do what's called a motion study. We have you bring your head forward and back, and that lets us see if those nerves are going to heal fast or slow and exactly where the problem is to correct it. So thank you for watching. We love questions. If you've got any questions for us, you can contact us at 608-233-3588. Celeste and I are here to answer those questions, and we'd love to hear from you.